So once a patient's failed conservative measures and we're talking about surgical intervention, the next step is to go over what are the risk factors for surgery. And usually the first question patients ask me is anesthesia safe? So in general, today's anesthesia is probably safer than it has ever been throughout history. The risk of death from anesthesia is about 1 in 100,000. The more comorbidities you have, the more risk you have. If you have diabetes, high blood pressure, had a history of previous stroke, history of heart attack or coronary artery disease, all those risk factors go up, and we have to make sure your medical doctors and your cardiologists give you a good clearance and minimize those risk factors for surgery. Anytime a patient has surgery, there's always a chance for pneumonia, secondary to either aspiration or just simply from the general anesthesia. Risk for blood clots. Anytime a patient has surgery, their body goes into what's called a hypercoagulable state. So patients that take birth control pills, testosterone supplementation, or have a family history of blood clots are higher risk. Infection. Infection is always what patients are asking about. What is my risk for an infection? Generally, a risk of infection for a patient where no implants are placed will be probably 1 to 3% in that range. Once implants are placed into a patient, whether it's screws and rods or a spinal cord stimulator or a pain pump, there's a foreign body in the patient's body, and that has a higher risk for an infection. If a patient's diabetic, that risk goes up. If a patient is fairly healthy, that risk goes down. It can be anywhere from 3 to 5%, sometimes up to 10%, depending on the risk factors present. Blood loss. Anytime a surgery is performed, there's a chance for blood loss. Most of our surgeries done today are done minimal invasive with very minimal blood loss. We no longer have patients give blood usually before spinal fusion surgery because the surgery is an outpatient through tubes, through smaller incisions. But occasionally we have big operations that do have a risk for blood loss. Anytime we do work on the anterior spine, where we have to work around the big blood vessels, such as the iliac vein and artery and the aorta and vena cava, there's always a chance for large blood loss. And usually those surgeries are performed with an assistant surgeon, a vascular surgeon, or general surgeon. Having a heart attack or stroke is always a risk factor. The older the patient, smokers, patients that have coronary artery disease or history of previous blood vessel problems have a higher risk for that. But those are general risks with any surgery that we just talked about, but spine surgery has even more specific risks.